Response to the H1N1 mist was slow at first, perhaps because the number of reported cases was still relatively low, or perhaps because a lot of misinformation was causing safety concerns in the public's mind.
For me to be down here today, I'm setting the example for our department. The vaccines are in, and as the chief of the department, I want to show that I have all the confidence in the world in what the doctors have said, what our own department doctor has said, that these vaccines are safe, and that's why I'm down here.
Whatever the reasons, once we began administering the injectable vaccine here at the Health District, it took all of our training and emergency preparedness to meet the demand. The priority groups being served first by the Health District turned out in force.
7.5 months pregnant, my doctor said it would be a good idea if I got one.
If they let me, I'm going to get it for sure, but I just really want to make sure that she gets it.
Well, definitely my doctor was saying, absolutely, as soon as it was available.
Members of the Medical Reserve Corps, Health District staff, contracted nurses, and volunteer pharmacists worked long hours to make the first free Saturday H1N1 injectable vaccine clinic a success, serving more than 2,700 clients by day's end.
My function today is to be operations chief or incident chief. So basically, I'm running around trying to make sure everybody has what they need, trying to make sure that we're doing things as efficiently as we can, and trying to get people through as quickly as we can. Pregnant women are very at risk. We do know that they do not seem to have the ability, the immunity, and if they get the flu, it does tend to roll into an underlying pneumonia, which because of their abdominal girth makes it very difficult for them to recuperate. So pregnant women are really at risk, and they do need to get the vaccine.
At the Health District, we train for emergency situations regularly, and part of our preparedness is using what we call pods to immunize large numbers of people. That's exactly what a large-scale immunization effort, like the current H1N1 situation, requires.
Immediately upon arrival, our function changed completely to running 2 areas instead of just a single pod, and that was to respond to the great response we've had in the community where we pretty much have people wrapped around the building. We want to try and get them in and waited on as soon as possible, so we've opened up 2 areas, and as we speak right now, we're staffing several more vaccination locations. And I think you've heard in the media out there that the shipments are not exactly what people have expected, so it's whatever we have at the time, we will happily dispense to the appropriate people.
Lorraine's comments touch on a couple of critical points. One, that H1N1 vaccination clinics happen at the Chatelaine campus as long as we have vaccine supplies. Please note, dates and times may change, and up-to-date information will be posted to our website. Which brings us to point 2. So far, we have no shortage of the flu mist, but we initially saw delays in shipments of the injectable vaccine. We have received additional shipments of the injectable vaccine on a regular basis, and information on its availability is also posted on our website.
The priority groups first eligible for the H1N1 vaccine at the Health District were pregnant women, people who live with or care for children younger than 6 months of age, healthcare and emergency medical services personnel with direct patient contact, children and young adults between 2 and 24 years of age, children up to 18 years of age with chronic medical conditions. Check with the Health District often, as the priority groups being served may change based on vaccine availability. The medical screeners you see at our clinics will determine which form of the vaccine is appropriate for you, inhaled or injectable. And all H1N1 vaccines are free.